All right, 30 seconds left. All right, 9 seconds left. Pick the answer. All right. Very proud of you guys. Remember, Erickson, if we don't take the time to learn it early, it's going to be painful. There are 8 stages, and we must focus on the conflict and the age. The age will guide you to the correct answer, right? So even if you don't understand the true conflict, what's behind it, if you can take the time to memorize the age, it will help you so much. Okay, so when we look at intimacy versus isolation, what we remember, anywhere between 20 to 35. So during intimacy versus isolation, it's all about finding someone to live with, right? Being able to stick to a relationship is a milestone of adulthood, right? So when someone is not able to do that, they may withdraw, right? And if they're having stable identity, they face, they may face, if they, they may face some challenge if they fall into the isolation, right? So the patient in this scenario here was doubting her ability to maintain a lasting and meaningful relationship. Maybe she was feeling not worthy of it, right? Therefore, feeling isolated. It mirrors the intimacy versus isolation. Please remember the age. Do it early. Okay? I'm not going to go back on the others because we have tons of questions in the same style next. I don't want to give it away since we are actually doing $100 for the first 5 people. So let's do this. All right, we got 8 seconds. Pick an answer. All right, Max, right? How old is Max? And how is he feeling? Inferiority. He's having trouble with his classmates, right? So we talked about that. That is very important. Oh, okay. It's very important for this conflict, industry versus inferiority. How do they feel about their peers in performance? I know some of you guys are like, man, I feel that person get it all the time and I can't get it. That's not the same way, right? So the school age is very, very important. They need peer support, placing themselves right in the middle of a school age, which is 6 to 12, right? They feel industry when they're doing good. They are able to read, write, do things that their peers are able to do, right? And they feel in fear for inferiority when they're struggling to fit in, okay? or refusing to work as a group, maybe has some doubts that they can actually do the work. And in psychiatry, we have to explore a little bit deeper and just not say, oh, this is, the natural growing development. We have to look up what is really behind. What is the root cause analysis? What's the root cause of the problem? Is this anxiety or is this ADHD that is pulling the patient back? But for the test, understanding Erickson, specifically the age, endorsed reverse inferiority is high yield. All right, we got 10 seconds. Please pick an answer. Select an answer. 5, 4, 3, 2, 1. Done. All right. Again, if we look at the age right away, you would have got this question correct. Okay. Initiative versus guilt. Right. So in this scenario here, Lucas, he is 4 years old. What is this early or preschool age of initiative versus guilt? 3 to 6. Right. And this is why I think I repeated myself maybe 10 times on Tuesdays and Wednesday, how important it is for you to do it early, very early. Please take the time to understand Erickson. It will be on your test. I guarantee you. 3 to 4 questions at minimum. Okay. Initiative versus guilt is high yield. Preschool age, right? Are they able to resolve the core psychological conflict or not? The goal is to initiate, do things for themselves. At this age, the child begins to assert some power and initiative over what they have control, right? Directing play uh, and interactions overall. So in this scenario here, Lucas constantly asks questions, imaginary friends or game. If we're talking about Piaget, we're looking at pre-operational stage, right? Desire to start things, doing tasks, are classic part of building initiative. So if Lucas cannot, it falls into the guilt portion. Okay. So hopefully this is a good explanation, and I think we're getting the core. We have to memorize the age early. See? Some people didn't even read the question. They looked at the age, they already know the answer. And that's a lot of people. Oh my God, you guys are fast. Fascinating. You didn't even read the question, man. You cannot read that fast. I know. There is no way. Don't do that on a test, okay, please? But these are the people that are going to pass. I'm telling you right now. All right, we got 8 seconds. All right. All right. So some people just saw 75 and say, hey, this is integrity or feel despair. You want to be old, sit down on your the porch and reflect on your life and say, yeah, I made some mistake. I am human, but I took chances. I Even though sometimes I was afraid, I did it anyways. And because I put my best effort, things turn out okay. You want to make mistakes. It's normal, it's human, it's part of growing. No one ever develops anything perfectly. But you do it again and you wake up and you do it again and you wake up and you do it one more time and never stop. And you achieve your goals. When you are able at this age to look back in life and say, you know what? It was worth it. Every bit of it was worth it. And anything that's worth it is never easy. Because if it was easy, then everybody would have it, right? It's not easy. And you don't want to easy anyway. So that is integrity versus despair. Look over 65 years old. Here, Susan is 75. It gave it away right away. So if you are new to today's Kahoot or to our class, or you haven't joined, or whatever may be the reason, those people that just saw the age and didn't even read the screen, they are listening, right? They saw the age, boom, done. Okay. Think about how much time you will save on your task if you do this early. Good job, everyone. Great job, Ashley. All right, we got 10 seconds. All right, so again, if Erickson memorizing the age is so important, do not memorize or do not, it's good to memorize the age on PAG, but do not fall for the age. Age can complement, but can be super misleading for PAG. We can have a borderline patient not meeting or achieving sensory modem. But wait a minute, that is young child, 0 to 2, he's 35, right? It doesn't make sense. So for PAG, do not pick your answer based on age. Now, the description here was pretty telling, right? Imaginary friends, role playing, pretending to be a cook, maybe having some tea, or imaginary cop. That is high yield for pre-operational. And we talked about um, egocentric, seeing the world from their own perspective as a child, natural and normal, right? We have to be tolerant to the child because we all actually been there. I'm sure I made my parents mad every once in a while, maybe every day, right? So we can't just be very rigid with our children, but can't give them everything either, right? So have to find the balance. So here it was a very telling description of a pre-operation PAG. We have to know that as well. Okay, sensory modem, concrete, high yield, formal, super high yield. And watch, even though we kind of went over a lot between concrete and formal, I wish we would get 100% on the next question. But I know That may not happen. Let's see if the next question is about PAG. Oh, damn. We got 10 seconds in. We have 72 answers. What is that? They want the money. They want the $100. That's what it is. Okay. All right. Fair. I would hate to play poker with you guys. All right. We got 10 seconds just about to pick your answer. All right. So how would they pick the answer so fast? So fast. It talked about complex operations. It talks about making the appropriate answer. Talked about a higher level of thinking, right? And when we think of a higher level of thinking for PAG, remembers the F for formal. F is later in the alphabet compared to concrete, right? So science projects, thinking abstractly, uh, hypothesis. It is super high yield that you remember those keywords. And this is how they were able to answer the question in less than 1 second. Okay, if you still reading like how in the world, no, they've been studying, they've been getting the keywords, and they're able to kind of get the answer right away. Just don't do that on the test, okay, please. All right, so let's do this. So sensory modem, PAG, concrete, and form. So Peter can fly helps you remember um, those 4 stages for PAG. Next question. All right, 2 seconds and go. All right, perfect. So you guys keyed in on the early stage here, phallic stage, self-discovery. Sometimes tests use masturbation, but this is not a pornography, it's self-discovery. That some people go through this phase. Well, according to Fyodor, everyone goes through it, right? So the core team here is self-discovery, and maybe looking, hey, I may have a body part that's different than my mom or my dad, right? So curiosity in this scenario as playing doctor. This concept is very high yield and to some people uncomfortable. Okay, oral stage, the child or the baby gets the pleasure from sucking, whether it's the thumb or pacifier. Anal, bowel control, and latency, nothing's happened, no sexual desire of any kind until adulthood or later teenagers. Okay, puberty. All right, 5 seconds. Okay. Oh, okay. So think about this. CBT, cognitive, it's all about the mind or correcting the cognitive restructuring that is putting someone into distress. And then the behavior is doing something, right? So when we marry both of them, then we have cognitive and behavior therapy. There can be two therapies separate and can be one therapy combined. So the part of exposure therapy, the core of it is very simple. It's much like PTSD. It's re-exposing someone through those fearful events until they don't fear as fearful anymore, right? So the cognitive restructuring is part of cognitive therapy. The exposure therapy is part of the behavior, right? So hopefully that is clear, because you need to know cognitive therapy, behavior therapy, and cognitive and behavior therapy together. Okay. So exposure therapy, it is really is the core to help with fear and avoidance. It can help with OCD. Exposure therapy can help OCD. Okay, remember that it will be used for exposure therapy, help people with OCD as well. All right, 8 seconds. All right. So whether it's client-centered therapy, Rogerian, or sometimes called humanistic, self-actualization, keyword self-actualization, and self-growth, right? And we can also apply that to Maslow's hierarchies of need, right? When we talked about hierarchies of needs, that human needs are pretty much not static, but we must meet the basic needs first in order to think of self actualization. If we look at the top of the pyramid, as I stated all the time, despite some of you guys being distressed right now, you are in the top of the pyramid, right? Because you have achieved the basic needs of life, which is the physiological needs, right? You have definitely your breathing, but you have food, water, shelter, sleep, homeostasis to some degree, security, right? You may not have the most wonderful job, because I know you are going to walk in the test center being an RN and coming out as a PMHNP, but you have a job, you have resources, you have morals, right? Family, place to be, security, safety. And then friendships and love, that kind of as we go up a little bit more, is not as rigid, right? Some of us can fluctuate a little bit. you all have self-esteem, good self-esteem, despite of some of you guys thinking that you may not, or personally you may not. I have some people saying that they don't, but I highly doubt that. Because if you didn't, you wouldn't challenge yourself as much. Because if you always think that you would not be able to accomplish your goals, you would not put yourself through a hard situation. So you did. You went through school, you graduated, or you're about to graduate. So you do have good self-esteem. You just got to do a little bit cognitive restructuring there, right? And look at things for what they are and not exactly the moment that you're living right now. And then on top of the pyramid, we have self-actualization and self-directed growth. These two words are key for you to master patient-centered therapy. We need to know Rogerian therapy, humanistic therapy, the same thing. Okay, so I say Mr. Roger to help me remember his name, right? Only humans can achieve self actualization and self directed growth. It is all about the patient, unconditional uh, uh, listening, activity, and patient center, right? It really highlights the core of humanistic therapy. It's all about the patient. Carl Rogers is a name that you need to remember. And remember, it can be called Rogerian patient-centered therapy or even humanistic therapy, which is not really a true thing because humanistics is the bigger umbrella in which meaning therapy, gestalt, existential therapy, logotherapy, patient-centered therapy falls under. Okay, but it's used interchangeably to some degree. It's all about being genuine, being concerned for the welfare of your patient. Okay, and behavior modifications, psychodynamics. You definitely need to know a little bit about psychodynamics. Sometimes psychodynamics or psychoanalytics are used interchangeably, but they are not necessarily the same. I don't think the test would ever ask you to compare one or another. Theodore is the known as the father or the founder for psychoanalytics or psychodynamics therapy. But you need to know that for the test, please. All right. Just like Rogerian patient-centered therapy, or sometimes called humanistic, self-directed growth, and self-actualization are the key words. Existential therapy, please write this down. What are the key words? Freedom and responsibility. Okay. So the goal is to really find out what is the reason for your existence. What grounds you? What keeps you alive? Right? And they really push the patient's button and sometimes even pokes them a little bit and tell, hey, can you take some responsibilities for the situation that you're currently in, or everything just happened and you're a very unlucky person? Can we start by saying maybe some of this it was because of the whatever you chose, which is okay to make mistakes, but can we take accountability to start with? And then you have freedom to make choices. And that can be dangerous for some people. Some people don't do better not have freedom, right? So as a guy that's been in the military for 23 years, right? With no freedom at all. Like, you have to be here at 05 in the morning. Oh, no, no. 05 is 05, right? Uh, but in a sense, right, freedom can be a great thing, but can also get people in trouble because they can choose unhealthy lifestyles and so forth, right? Existential therapy really needs kind of know. It really is championed by Yalom, right? Viktor Frankl is really core for logotherapy. Viktor Frankl, you need to know Viktor Frankl for logotherapy, which is very, very similar to existential therapy. Okay. So if you get anything out of this, you say existential therapy, I will never forget freedom and responsibility. These are keywords that often play out in almost in open any book. I challenge you and look for a question, true book for existential therapy. Always they kind of may not say freedom, but it says choice. That would be kind of similar, freedom and responsibilities. Okay. And obviously reasons for existence. All right, we got 8 seconds. I think this is a very hard question. Very hard. Unless you have been in our class yesterday, right? Or the day before. Because up to the last maybe 2 or 3 sentences at the end, it had CBT written all over until it mentioned conflict resolution, not being able to get along with family member. And that gave it away the entire question. Guys, when we do class, pay attention keywords. Interpersonal therapy, it's all about discord, finding the middle ground, specifically with couples fighting, right? Don't pay couples therapy. That is interpersonal therapy. What gave it away was the conflict with the family, right? Generally speaking, for major depressive disorder, CBT, cognitive behavior therapy, is very effective, right? It's a fantastic first line treatment for depression, for sure. But the primary mechanism here, right, uh, for cognitive behavior therapy is the negative thoughts about self, world, and the future, and the behavior activation. Now, when we looked at this question, it emphasized relationship conflicts, having trouble, and therefore isolation as the driving force, which would be solved by, not that CBT cannot solve it, but primarily for test purpose, interpersonal therapy. Okay. So remember, interpersonal therapy, I don't care what kind of question, if you see conflict, fighting, discord, interpersonal therapy. and that's what you're trying to solve. All right, we have 15 seconds. Two seconds. All right, so again, the question was pretty difficult until the end, and asked specifically, when we're thinking about psychoanalytics, what is psychoanalytics? What's the core of it? So hopefully, if you were in our class Tuesday and Wednesday last week, you kind of went over that during psychoanalytics field work, it's all about bringing the unconscious mind, the unconscious conflict to the therapist. We need to expose that. And we talked about how can someone bring something to the table if they're not aware of it. And that's when things develop during psychoanalytic psychodynamics therapy. It's finding out the unconscious mind, things they're not aware of, and bring it to the therapist. The therapist wants that put on them, okay, so that they can explore. Maybe it was that traumatic event that you don't quite remember, or do you don't want to remember when you were 5 years old. Maybe it was the dog that bit your leg. Maybe it was something in the past. And until that is brought to the present and we can discuss and work on it, that still affects someone's life on the present. Okay. So, oh, let me see if I can make this a little bit bigger. I'm not sure if you guys can see it or if it's, no, I can't. Let me see if it's helpful if I kind of just, can I make it a little bit bigger? Or you guys can make it a little bit bigger in your own screen. I'm not sure. Okay, I'm actually making smaller. All right. So when we looked at field work, really the core is to bring the unconscious conflict, address those mechanisms, and past relationships, traumatic events that still playing in the present and someone is not aware of. When we talked about cognitive restructuring, remember that is part of cognitive therapy. And when we talked about CBT, cognitive restructuring, journaling, and behavior therapy, which can be role playing, it can be modeling, right? Exposure is all part of the behavior portion. Mindfulness, it's always bringing to the present, noticing things that we don't maybe necessarily notice often. How is our breathing? The taste of food. Maybe we eat fast because we're always on the go. Just kind of being able to be here and now, appreciating the flowers outside, right? The little things that sometimes we just zoom by and don't pay attention. Uh, and behavior manipulation is not really super high yield, so I always skip for that reason. All right, we got 5 seconds. Pick your best answer. All right. So, sometimes even if we don't know exactly what it is, we can have a good idea by the spelling, right? Morphing or morphogenesis is the creation or changing into something new, right? In this specifically example of family system therapy, family is the process of adapting and changing the family roles and dynamics over time. We are morphing, we are creating over time and changing the family dynamics. Okay. Always remember keywords. Now, if we say um, keywords for more, if we say keywords for family system therapy, self differentiation, triangles, and genograms, right? And specifically, who's the founder of family system therapy? Okay. Okay, so family system therapy, it's in a nutshell, really is focusing on how the family interacts as a whole, right? And that each one of us, although part of a family and have a role in the family, we still can be our own self and be able to part away from the family. But a focus on interactions, patterns, relationship dynamics, maybe unclear boundaries, and communication. Now, as I was reading this question, the thought came to my head, what is her diagnosis? A, PTSD, B, major depressive disorder, C, adjustment disorder, or D, generalized anxiety disorder? What would you say her diagnosis? All right, adjustment, right? So everybody got there pretty easy. If you didn't, then you kind of like have to ask yourself that maybe you are you need to key on the reasons why, because it does have conflicts, it does have some maybe hints of depression, a little bit hints of anxiety, not feeling well. But what makes adjustment disorder, it was the parents, right? The situation with the family, it's causing those feelings, the uncomfortable, and she wants the family to be normal again, right? And then for adjustment disorder, what is the treatment of choice? Anxiolytics, like SSRIs, or therapy? B would be therapy, A would be SSRI of a choice. What do you say? B, right? B. Very good, right? So for adjustment disorder, therapy is usually the core. Now, in real life, sometimes you can do a little bit of SSRI, maybe at 25 milligrams of Zoloft, but the core, the correct answer is therapy. Okay. All right. So I think we covered a lot about what is going on here. Let's move on. All right. Not to call out anyone, but the question or the answers were on purpose left you with the answer right in front of you. Okay. Just to see if I give it to you, would you take it? Was a actually experimental test, right? If I give you the answer, would you take it? So the only answer, it asks you, what is the core of self-differentiation? What is it? The only answer that has self-differentiation in it is right there. It's a self-differentiation, maintaining personal autonomy and emotional calm despite of what is going on. It's being part of the family, but also being your true self, right? And everything else, it describes something else. So sometimes if you come across a question that you have no idea, and you absolutely have no idea, look for keywords in the question and look for keywords in the answer. This one was a straight up take it point, right? To see, even when you don't know what the answer is, can you still get the question right ultimately, right? It might have few more like that. So pay attention, okay? So you also need to know that the goal of family system therapy, it is self differentiation, super high yield, right? Meaning that a individual can experience a major conflict without losing their own emotional balance. They can still be the father, the daughter, and still be able to disconnect. They should be able to self differentiate from the family, even though they are part of a family and the family is connected. Everyone's connected. And if an issue affects one, it will affect the other. There is no way to hide behind it, but it's still, we cannot let it be in such a way that takes control of our own lives. Okay? All right. So the red was enticing, right? Because it had boundaries in it. But is that one person's boundaries or the whole family dynamic boundaries, right? So we talked about we need to kind of get the key words when we say structure family therapy. We need to remember hierarchies, maps or genograms, boundaries, enactment. These are high key words that we need to know for the test. We have to know those early. Okay. Great flashcards. You can make it. All right, 5 seconds. Pick your best answer. Three, two, go. All right, so MST, multi-system therapy, is exactly what it sounds like. It's several combinations of therapy. Why is important? To help the family gain control of those young adults, adolescents, usually between 12 to 17 years old, that often are committing crimes, to get a hold of the behavior before they actually become through crimes and develop into something more serious like antisocial personality disorder and so forth, right? So you need to remember who are the population, those young adolescents that are having behavioral issues. The goal to provide the family with the tools to curb the behavior and prevent those young adolescents from leaving the house early and getting into more trouble, right? Yes, it definitely can, right? It can go. So in order to be, not for the test, right? But if you ever diagnose of someone with antisocial personality disorder, e- older, well, to begin with, it has to be older than 18, right? Before you do that, just like ADHD, you have to check back to younger years. ADHD, less than 12, must have had, that is important, must have had the symptoms of inattention or impulsivity, right? So why is that important? Let's clear that up. Because if you have an older adult coming in and saying, I think I have ADHD. Lately, I've been losing my keys, can't complete tasks. You need to explore other diagnoses. What I just talked about is super high yield. Okay. Now back to antisocial personality disorder. In order for you to give someone a antisocial personality disorder diagnosis, you have to go back young years and see if they had the traits of conduct disorder. It is part of the DSM-5. Okay. So what are the traits? Killing cats, animal cruelty, stealing, money from old ladies, whatever that might be, serious behavior issues, right? And multi-system family therapy, it is the population that are committing crimes and may developing something more serious as they get older. All right, 10 seconds. All right, perfect, right? So that's what multi-system therapy is really targeting the behavior at home, in society, in school, in different environments, right? Uh, and they try to help them get control before it gets to be too late. Okay. All right. I think we beat this one down to fully understand the concept now. It's okay, Dr. Lynette Omar. All right, one, go. Now, we talked about solution focused therapy. You are looking for a solution in the past to help the present. What kind of solution? Miracle solution, miracle question, exceptional finding question, scaling questions. If you memorize three things for the family system therapies, or whether it's structuring, um, family system therapy, strategic, right, multi-systemic, you get all these questions right. It's almost impossible not to, but it takes a little bit of work, okay, and early. Don't do it before the test. It's too late because there's a lot of therapies that starts with an S, so it's kind of can be a little bit difficult, right? So the core here for solution focused therapy is the hallmark here is to help the client in this specifically example what it would be like if the problem didn't exist. How would you feel? Is envisioning the future without limitations, right? So why would that be helpful? Because it helps them to bypass the problem, what is causing, and thinking to help the family to identify their goals, exceptions of their problems, right? Helps them to have actions, steps towards change. Instead of being focused on the problem, what it would be like if the problem would not be here? How would you feel? Okay. So we can do miracle questions. In this example here, we can say happens because overnight in your communication, let's say, and your communication struggles vanish, what it would be like if the problem wasn't here anymore, right? So that can be very helpful uh, to visualize, and maybe now that we felt what it would be like not have the problem, help us drive us towards the goal. Hopefully that it's well understood. But I always think of a solution working something from the past to fix the current problem. So again, it was a giving, right? Because it asked about what is rationalization, and I straight up put it the keyword there just to see would you take it the point if it's given to you, would you take it? Because what would be the correct way of giving you an answers? I would have to take away projection, I would take away repression, I would take away rationalization, and I'll take away displacement. Even though I didn't, we still have a problem, right? We have to pay attention because these are 100% giving. So when something is giving, the test may never do that, I doubt, but it helps you to recognize if I did not get this question right, even if I know the content, am I really pay attention on what I am reading? Am I focused? Right? So hopefully that is helpful, and is not a criticism for anyone by any means. But we need to get those easy questions 100% every time, because there will be frame questions. Motivational therapy, they are nebulous. They are difficult to get those concepts. It's pretty much a lot of judgment. It's like English. Some people will say, "Oh, I write my patient perfectly," and somebody else look at it like complete trash, right? So it's true, right? I'm like, man, I'm the best writer. Nah, sorry, not really, right? But that is what we need to pay attention. Okay. All right, we got 5 seconds. All right, reaction formation is super high yield, very high yield. Okay, so that's a good example of reaction formation. I think we talked about 6 yesterday, defense mechanism, and then we said the seventh one was autism fantasy. I will add one more, reaction formation. Okay, and here it was really, can you identify the ego defense that the patient was exposed to or dealing with internally, the guilt, the shame, the unwanted urge, right? Reaction formation is when an individual unconsciously transforms an unacceptable anxiety provoking impulse, desires, or sometimes attitude of the past behaviors into its exactly opposite. It's almost like if you never knew their past, you would almost 100% believe on what they are saying. But now that you know their past, you'd be like, doesn't make sense, right? So the clinical application here, the patient has deeply ingrained history of substance use disorder, which likely generates this underlying shame or an ongoing unconscious craving to use. The defense to defense against these painful feelings, the ego flips the script completely. So the patient adopts an exaggerated, ultra normalistic, and aggressive attitude against drug usage as a stance to convince both themselves and the people they are talking to, right? Advice. So make sure you understand reaction formation, and make sure you can create few examples out of the blue from your head. Can you provide some example of reaction formation? It is very high yield. And obviously repression, displacement, autism fantasy, sublimation, rationalization, and so forth. The patient largely remains unaware and denies if it ever happened. That is the repression. It is a self defense mechanism that puts away those traumatic events. And again, pretty much a given here. And I think we are getting better and picking up those points because it says he does not acknowledge that unconsciously buries the traumatic memories out of awareness. And that's why we need psychoanalytics and psychodynamics to bring the unconscious mind to the present to help the current issues. That is repression, core of Theodore. Okay. Now, as I was reading this event or this description, what do you think? Let's say instead of headaches, it was more of a seizure or blindness or neurological symptoms. What would be the diagnosis? A, adjustment disorder, B, severe anxiety disorder, or C, conversion disorder. So conversion disorder, right? So, because also in the scenario it says that the doctors cannot, the medical team cannot identify the cause. But with conversion disorder, there is a traumatic event. The symptoms are neurological symptoms, and usually goes to the medical team and they can't find the reason, right? It would be a little bit more descriptive, but it really was 70% there towards the conversion disorder. Okay. Let me see here. So when we talked about altruism yesterday, what are some of the key words that we can come up with when we talk about altruism? Support and feedback, yeah. But more so, I like to think of giving a hand, helping someone, right? Giving to others. So that's an even better description. Helping hand. I like to say the helping hand because it helps me remember altruism, right? So that is the core. Because I kind of mentioned this, when you help someone, they may think that you are helping them, but you're really helping yourself, okay? Because that boosts your ego, that helps you. You feel, hey, I'm useful, right? Like, who doesn't want to feel useful or helpful? I think that is really good thing, right? Um, so when you're helping someone, you bring value to your life, right? Because people are asking for your help because they consider you to be helpful or can help the situation. So that kind of helps yourself, really does. So, and obviously we can't always give 100% of thousands of time, but the more we do, the better it is for our own self in a sense as well, right? Because there is a purpose for what we do. So those people in group therapy, they tend to help each other. They tend to, even though most of them are in some kind of a crisis, one of them kind of stands out and say, look, I'm going through similar situation, may not be exactly what you are going through, but this is how I have cope with this situation, and helps another person. You need to know altruism. We went over about 10 of them yesterday. Yalom. It is very high yield. You will be asked about Yalom. 100%. Not maybe. You will be asked. Okay, again, I think it's the third question today. Giving 100%. We got to get better at picking up questions that is given to you 100%. So we talked about recovery model. Only one answer has recovery model in it. Even if you didn't know what the recovery model is, maybe you just show up here today. I totally get it, and this is not a criticism, but it was pretty much given to you because the other one talks about the medical model, deficit model, compliance model. The only question that talks about the recovery model is this option here in brown. Now, for the test, imagine this. Do not look at the answer choice. Do not look at the answer choice. It talks about recovery model. What is the recovery model in summary? It is non-linear. It will be setbacks, and we will learn from the setbacks. Okay, so it's not perfect. It's not a straight shot to the moon. So you need to remember keywords non-linear, right? With setbacks and learning from it. What is another core dynamic of the recovery model? I do not care about your diagnosis of schizophrenia or bipolar. I want to know, what are your dreams and aspirations? What do you want to be? That is part of the recovery model. It is not part of treating the disease or the condition, but it's all about patient center. What is important to you as the patient, right? While the medical model is like, here's your diagnosis, here's your pill. The recovery model is, I want to know what is your desires and aspirations. And if you put those keywords, I don't care what kind of question they give it to you, you will get 100% of the time. Now, you have to memorize those keywords and you have to understand what it is. When you read the question, 100% of the time, you probably get it right. As long as you took the time to memorize and understand what it is, now there is no question that they can make up that you would not be able to figure out. Okay? It's really key pillars: autonomy, self direction. What is important to you as the patient rather than me telling what I think is evidence based practice? I am interested on what is important to you rather than the diagnosis itself or achieving resolution of the diagnosis. All right, so now we did it. Now we did it. So let me give it a huge congratulations. So we got 100% good job, like really good job, right? Proud of you guys. Even if you didn't know what it is, we just talked about it a second ago. The recovery models will be setbacks, and it's okay. Can we learn from failures, from setbacks? Can we learn from it and not make the same mistakes? Because the definition of craziness really is doing the same thing and expecting a different result, right? If you went through some traumatic event and you go back to doing the same thing that you did before, you're likely to get the same result. So we have to change, we have to learn, specifically when we went through a negative outcome. How can I make it better next time, or different at least? That is the recovery model. Okay. All right. All right. Get it, but it's pretty close to 100% again. What is the ACT? I think we are getting the theme of things. It's like 6 or 7 questions in today's event that was pretty much giving. We need to know what ACT is. A community model. What is the goal of ACT is pretty good to know. You need to know is to keep patients in the communities. I don't want you back in the hospital. I do not want you in the inpatient unit. So how can we prevent the patient from coming back? Let's set up a group of doctors and nurses working 24 hours a day, 24 hours, 24 hours, physical therapists, all kinds of teams getting together to providing resources to those patients so that they can thrive in the communities. Okay. What else? So, what is the goal? Community therapy and not back to the hospital. Who are the patients that we target? Often patients they're uncompliant with medications, right? They don't take their medication, they come back to the hospital. Come back to the hospital, we're back in this cycle all the time. So, can we do something about it? So bipolar, schizophrenia, these are often target. They can be major depressive disorder too, depending how severe, right? It can be other diagnosis, schizoaffective disorder. But what it is it? What is it? Group of professionals working 24 hours. Why? Or what is the goal? To keep patients out of the hospital. And who is the target? These are the three things. Who are the target population that we need to know for sure, because you might get one question or two about ACT, and if you can get those three little things about it, done. You don't even need to know in details and who pays for and how is it run. That is extra, okay? But think of a team that meets the patient where they are at. Low barrier, right? 24 hours, holistic focus. All right, last question of the day. All right, so we're getting better, right? Because it was exactly the same question earlier. And we had a lot of people picking cognitive restructuring. Now we had 10 people, right? Other people pick mindfulness. But again, it was a given question. Exactly the same. Okay, maybe it wasn't exactly. The other one I think was 52 years old. This was 40 years old. Other than that, it was exactly the same question. So why? Well, we have to get those key things, the key terms, the understanding of the content, because this is how it's going to be in the test. What you learn right now in the course will be on your test. And if I spoke about it, if we talked about it and you don't understand, you need to let me know. So that way I can find a different way. Okay. If it's not well understood, I'll find a different way. But when we talked about cognitive is one thing, is restructuring the mind or changing the way the patient is thinking, behavior, modeling, exposure therapy, pretending play, right? Talking to yourself in the middle. If you are looking to have a tough conversation with your boss, maybe you may have to practice. That is the behavior. And in this case, for panic disorder, what is the behavior that we are going to do to help the patient? Expose or exposure therapy is a type of behavior therapy. Okay. So hopefully, if it wasn't clear the first time, now it is. And other than that, I think even if you didn't make the podium, it's still well worth it your time to be here. Maybe you get one or two, maybe 10 questions right on your next test. So, but for now, we have to congratulate Caitlin. You're first place not too long ago. Gift. She kind of like took the second place, and the first place today is Lady B. All right, the three of you guys. Well, we got two more. Amidala and Vi Vance, is that right? Did I read that right? So let me know who you are. Let me know your names. You got $100 towards your, or if you want to, towards your psychopharmacology course. I need to know your name so that way I can make a coupon code with your name specifically for you. Congratulations, everybody. I know it's a long night. We had a long week. Now, next week is the crash course review, right? So remember, no middle of the week class. We are going to have a lot of homeworks. There are maybe 400 questions for you to do in the crash course review question bank, another 600 questions. So you have a very intensive week, and we'll meet for 10 hours each day, Saturday and Sunday. Okay. And make sure that we are really understanding the content, understanding, because those key points will likely be on your test. All right. So with that being said, good night, everyone, and I'll see you later. But I'll stay back to answer your question. Let me just start this recording here, and then we'll kind of answer a few questions, uh, whatever is in your mind right now. So let me stop this. Okay. Nah, I'm having trouble stopping the recording here. Excuse me. Okay. Okay. All right. So